Next, we will be going through your stage 2 exercises, which are the exercises that you will be doing once all of your drains have been removed. It is likely that your drains may be removed before your follow-up appointment with your surgeon, so be sure to move yourself onto the next stage of exercises. But when you are back in clinic, either the physiotherapist or occupational therapist will review these exercises with you. Again, with these exercises, we want you to perform them every day, 3 times a day. And again, it might be a good idea to take pain medication about 20 to 30 minutes before you do them, just so that you are more comfortable and get a greater benefit out of them. The first exercise in stage 2 is called the wand exercise. You can use either a broom handle or a stick or a cane to be your wand at home. To do this exercise, you'll be lying down on either a bed or a couch with your knees bent and holding the wand between your 2 hands. Then you will be slowly lifting your arms up, again, as high as you feel comfortable until you feel a nice stretch, but no pain. You'll be holding this exercise for a little bit longer than stage 1. The goal is 20 seconds at this stage. So remember to breathe and take nice deep breaths while you're holding the stretch. And then after 20 seconds, you will be bringing your arms back down to the start position to reset before you do another repetition. If you bring your arms wider along the cane, you will be able to feel it a little bit deeper, and it may be a bit more intense, so you may not be able to go as far, but that's okay. Again, you will slowly bring your arms up until you feel a nice stretch, no pain. And again, you're gonna hold it for 20 seconds and remember to breathe, taking nice deep breaths in through the nose, out through the mouth. The second exercise in stage 2 is called winging it. This exercise you will also be doing lying down on your back. It might not be a bad idea to have a pillow close by just in case you need the extra assistance for the stretch. The start position of this stretch is you will lie with your hands clasped behind your neck or your head and your elbows facing up. To bring upon the stretch, you're slowly going to spread your elbows apart, kind of like you're lying on a beach. You might notice that as you try to relax your elbows, that it doesn't quite get all the way to the surface of the bed, and that can be uncomfortable if you're holding the stretch. So what we recommend in this situation is taking a pillow and bringing the bed surface closer to your elbow so that you can comfortably hold the stretch for the full 20 seconds and not be in pain. So again, you're gonna take nice deep breaths in through the nose, out through the mouth for 20 seconds. Then you will return your elbows to the start position and repeat again 5 to 10 times. The next exercise that you will be doing are your wall climbing exercises. The first part of the wall climbing is facing the wall. So you will face the wall and stand with your arm about arm's length away from the wall. Next, you will be slowly walking your hands up the wall and taking steps towards the wall as needed until you feel a nice stretch, but no pain in the areas of tightness. Once you find a comfortable stretch, but no pain, I want you to hold this position for, again, 20 seconds and remember to breathe. If at any point during the 20 seconds you find that you need to back off a little bit to be able to hold the stretch for the full amount of time, that is encouraged. We also want to minimize any movement in the low back to help get your arm higher up the wall, and focus on the stretch and the movement just coming from your shoulder. Once you've completed the 20-second hold, slowly slide your hand down the wall to come out of the stretch and just do a circle to reset before you do the next repetition. If you have surgery on both sides, you will have to repeat this with your other arm as well. It's encouraged to do this exercise one arm at a time, since after surgery, you may have one arm that is moving a bit better than the other one. Once you've done 5 to 10 repetitions of the arms in the forward direction, you're going to turn your body so that you can work on the sideways motion as well. Same thing, you're going to make sure that you have good form by ensuring that your shoulders, your hips, and your toes are all facing in the same direction. And then again, you're going to slowly walk your hand up the wall and take steps towards the wall as needed, again, until you feel a gentle stretch in the areas of tightness, but no pain. When holding the stretch, you want to make sure again that the movement is just coming from your shoulder joint and that you're not twisting your hips towards the wall to make it easier. If you feel the need to bring your hips towards the wall, that means you've gone too far and that you need to back off a little bit so that the movement is just coming from the shoulder. Again, you will be holding the stretch for 20 seconds and remember to breathe. Once you come out of the stretch, again, slide your hand down the wall and do a couple shoulder circles to reset before going into your next repetition. If you have surgery on both sides of your body, you will also have to do the other arm with the same cues, making sure that you have good form and that the movement is just coming from your shoulder joint and you're able to hold it comfortably for the full 20 seconds. And once the 20 seconds are through, it's always important to slide your hand down the wall when coming out of the stretch. The final exercise for stage 2 is the corner wall stretch. What you will need to do is find a corner in your house. If you don't have a corner, a door frame works as well. With the arm on the side that you have surgery, we want you to stand with your hips and your armpit against the corner and your arms making a 90-degree angle against the wall like so. This is the start position for the stretch. You may even feel a stretch in your armpit area and chest wall just from this position. To add on the stretch or make it a bit more intense, what you will be doing is taking small steps with your feet away from the wall while keeping your arm in the same position. In this position, you'll feel a nice opening on the front of your chest wall. Again, we don't want you to be in pain, but just a nice gentle stretch. You will be holding this position for 20 seconds. Remember to breathe, nice deep breaths in through the nose, out through the mouth. After the 20 seconds, walk your feet back to the start position and then slowly slide your hand down the wall to come out of the stretch. Before you start your next repetition, be sure to do a few shoulder rolls to reset.